healthcare and AI have a very weird relationship in general, right? Because AI has had some massive public failures in the recent past few years.
The medical community is reacting negatively to the terms artificial intelligence, in large part because biology, unlike physics and chemistry, is still an observational science.
We're a long ways away from having true artificial intelligence, in part because we just don't understand the science of patient care and human physiology yet. It's still a very raw, subjective brand of science.
I think given the state of data in healthcare and given the state of incentives in healthcare, sort of shooting for massive changes at a very big scale is probably not the very prudent thing to do.
The future of healthcare is a platform of data about patients, about processes of care, about processes of health. It's a platform of data, and you expose that data to support whatever use case might come along. Right now, there's this perception that the electronic healthcare record is that platform, and it's just not. It was never designed for that.
Very important information in the EHR is wrong. It's factually incorrect. Things like, if a woman has breast cancer, something very simple, that's binary, right? It's wrong 40% of the time. Well, how do you know you're not garbage in, garbage out? And that could be actually dangerous.
We will not be able to fully utilize AI and machine learning in healthcare until we more fully digitize the patient and fully digitize the process of health as opposed to the process of disease.
The idea that you're going to suck in unstructured data, millions and billions of bytes of data with no reference point, and churn out in real time at the point of care without destroying workflow, actionable information, many physicians think is folly. So that's why I think there is still a little bit of this divide, but I think that divide will be solved. I think the people like Watson and IBM and Google, what I heard yesterday of what it's thinking to do, and other companies, they should march full steam ahead. But it's not an easy lift in medicine and in biology, and there needs to be that bridge.
I think it's actually better to focus on small successes and focus on growing out of those successes as opposed to saying we're going to go fix X completely end to end. From my perspective, these small wins are actually more important. And this is how AI will actually gain acceptance in healthcare, by building on, important problems, but working with a system that exists as opposed to throwing it away and starting from scratch. That's too much. I'm Gurjeet Singh. I'm one of the co-founders and the CEO of Ayasdi.
Dale Sanders, I'm President of Technology for Health Catalyst.
Hi, I'm Andrew Pecora. I'm the founder and the Executive Chairman of Cota.